Hi, I'm Dr. Tamara Beckford with URCaringDocs, and this week we're going over our weekly medical topic, and our topic today is heart attacks. That's correct, heart attack. All right. So, a heart attack, what is it? We're going to discuss what it is, what are some of the causes, what are some of the treatment plans that are done with people who are having heart attacks. But before I go any further, I would be remiss if I did not ask you to like this channel, like the page, subscribe, leave a comment afterwards. If you thought this information was great and someone can benefit from it, do not hesitate to share. Okay, share. But please do leave a comment so we can get better and so we can improve and provide great information for you. Okay, so this is Dr. Beckford with URCaringDocs. Our weekly topic today is heart attack. So what is a heart attack, right? What does it cause? Like, what is the cause of it? What are some of the symptoms that one gets when they have heart attacks? What are some of the treatment plan? What happens when you go to the ER? I'll go through all of that. So your Caring Docs is a telemedicine urgent care. So we take care of people who want to see a doctor quickly for their non-emergent medical issues that arise at inconvenient time. However, we also provide great information so you can make great medical decisions. Okay, so we'll do the heart attack. So, like we said, what is a heart attack? The best way to figure and understand what's going on is to, of course, let's start with a little bit of anatomy. So, I like to do my little drawings. So, here it is. So, we have here our vessels, right? So, these are coronary arteries. So that means these are arteries that goes towards the heart, which is what the coronary means. So when you have the vessels, this is a vessel here. So a vessel is a tube, right? And we have, these are our red blood cells that's moving, carrying its oxygen and nutrients through the tube. When we start to develop coronary artery disease, you start to develop a plaque, which I have here in yellow. So the plaque starts to develop within the vessels. As you can see, the flow starts to be diminished because the area for the flow to occur is starting to get reduced. Now, let's say we start to develop more and more plaque. That means there's less and less blood that can flow to that area, right? So with a heart attack, there is a lack of flow because something has obstructed that flow. So we'll talk about that. Now, people who have heart attacks, at times they might notice, like a few months or so before, that they might have some discomfort in their chest, especially with exertion. Why does this happen? Let's think about supply and demand. So with exertion, you start to need more blood flowing to the area. And if you need an increase in the demand, which is the flow of blood to the area, but the supply becomes less, then you start to notice that you are having a pain, and that's what's called angina. So angina is the pain that happens when you have decreased blood flow, when you need an increased supply. And that occurs, like, say, if you're running up the stairs, right? An average person, when we run up the stairs, our heart's beating faster because it needs to pump more fluid. If the area where the fluid is pumping is reduced, then, and we need an increased amount of fluid, that's where we start to have the pain. So that's angina. So angina, as you can see, you have developed plaque in the area. The supply is not able to get there when you have a high demand, and therefore you start to have pain, which the medical term for chest pain is called angina or angina, depending on where you live. All right, so you can have that due to plaque, as we discussed, due to cholesterol deposits or so on. That's what usually causes plaque, which develops after a few years, usually when you're in your 40s, 50s, 60s, then the arteries can be blocked by this plaque. Now, we've now discussed coronary artery disease, and we've discussed angina. So now we're going to move on to the heart attack. So this will be our third picture of our series. So we've had our plaque, right? So we see the plaque that's there. So during a time, we start to notice that the plaque is causing a disruption, and then a disruption moves and it dislodges a blood to the area that clots off the supply. So the blood clots off this area. So the supply now of the flow is interrupted. So when that supply of flow becomes interrupted, then you start to have a decrease. That's the same blood flow here. That's in a different picture. So that artery, the plaque, causes a disruption in the flow. So the blood supply to that portion of the heart is disrupted. And we need the blood to supply the oxygen, and we need that in order to provide nutrients to the cells. So once that nutrient is cut off, then here you start to have the cells start to die and become damaged, right? So the longer you are without the oxygen to that area, the more damage that occurs. And let's think about it. The heart is a pump, right? So it's a pump. If part of the pump becomes damaged, then the pump cannot be a great and effective pump. So the longer you are without oxygen to that area, and part of the pump starts to damage, that's what can cause some of people to develop congestive heart failure. Why? The pump is not as strong and effective as it used to be. Right? So we've talked about coronary artery disease, and we've talked about the plaque that can cause a disruption in the plaque. It lodges off and it goes and it gets lodged into the vessel and causes lack of flow, therefore lack of oxygen, and a death to the cells. So when you are feeling the symptoms of a heart attack, which for some people it's the crushing chest pain, you've seen the images where they're bent over with a chest pain. Some people feel pain in their chest that's radiating towards their left arm, right? Some people feel pain that radiates to their jaw and to their neck. However, there are some atypical ways that people can present with heart attacks, especially in women and especially in our elderly, right? So some people can just have nausea and just persistent burping or belching. And then they just feel, some people just wake up, especially in some of our elderly, and they just feel weak and they can't really get out of bed and they're not really sure. They don't have a fever, they don't have a cough, they're just weak and just like overall weak and unable to really move around. When we see some of those patients in the emergency room, some of those patients unfortunately had a heart attack. So there's some atypical presentation. Now, say you are having your standard heart attack symptoms, crushing chest pain radiating to your jaw and your arm. What is the first thing that you do? You call 911 if you're in the United States. If you're outside of the country, you call your emergency number and get straight to the emergency department. So when one is on their way to the emergency department, especially if you're on your way by ambulance, there are a few things that will get done. One, they will give you aspirin if you have not taken it. So why aspirin? Because aspirin helps to decrease the developing clot that is there. However, it's not the only answer. It's just something that helps to prevent the worsening of your symptoms, right? Once you get to the emergency department, you're going to notice that they're going to do a few things. One is they're going to be doing an EKG. So the EKG is done to show us if the symptoms that you're having is consistent with what we're seeing on the electrical activity. So you'll hear people say, oh, we had a ST elevation MI. So what does that mean? That means that there's a complete blockage on the flow to that area, and it's showing on that EKG. So in addition to that, they'll do chest x-rays and things are moving very quickly. But one of the things that they're doing is calling the cath lab for catheterization. So some people might hear it called like an angiogram. What is an angiogram? I mean, there's so much going on. It's, best for us to just go over this while we're in an environment where we can understand. So an angiogram is when the cardiologist will put a catheter, which is a catheter is a tube. So they'll insert the tube into the artery. Usually they do it in an artery in the groin, or they can do it in an artery in your wrist, right? So they introduce that catheter, which is a tube, into the artery, and they are moving it through the body, looking at this on an x-ray so they can see it in real time, and then they go towards the vessel and they're shooting dye through the arteries. If the dye moves through, then that artery is not blocked, right? If the dye gets to an area where there's a clot and the dye is not moving beyond that area, then that alerts them that that's the area of insult and that's where the clot is. So that same catheter they use, they has a balloon in where they open the vessel, they can get the clot, and then they can have restored blood flow to that area. In addition, they'll place a stent, which is basically a device to keep the vessel open. So that's how the catheterization occurs, so that you can have return blood flow to the artery that's clogged off, right? Why do we need return flow? Because flow of blood produces oxygen and it reduces the chance and the extent of the damage that can occur to the heart, right? So that's a catheterization. So all of this, as we stated, is usually done pretty quickly. You're being asked to give permission. There's a cardiologist who is like rushing in from home if it's in the middle of the night. They're rushing in from their office if it's in the middle of the day to come and to try and provide excellent care for you so that you can be able to survive this heart attack, right? So today we have gone over what a heart attack is. We've gone over um, why it occurs. We've gone over treatment and what occurs in the emergency department. I hope you enjoyed this video. If you did, please leave a comment. I hope you like and subscribe to the URCaringDocs channel and our URCaringDocs Facebook page. You can also find this on our URCaringDocs Instagram. That's URCaringDocs. That's a U and an R, Caring Docs on Instagram, Facebook, and you'll find us on our YouTube channel. I'm Dr. Tamara Beckford. I will see you next week when we'll go over a great medical topic here on URCaringDocs. That's URCaringDocs. See you then. Bye-bye.